Hello and welcome to Invita Medical Centers. We're going to talk about the critical parts of cancer treatment to help overcome the problems that are seen both in conventional and alternative cancer. Now, number one problem with the conventional protocols is that it is protocol driven, and no two cancers are the same. No two breast cancers are the same. No two same tissue types of cancers are the same. And I'll show you this in a moment. But here I want to make a point. In the 2012 annual meeting of American Society of Clinical Oncology, about 30,000 oncologists from all over the world will be at Chicago this year. If you look at the agenda on the meeting, it's 100% pharmaceutical drugs. It's become a big pharma industry, and we do have a place for chemotherapy when it's used targeted, genetically, given in fractionated doses, but just given in protocol, they don't always work, particularly in late-stage cancers. It's less than 2% effective in late-stage cancers. And the second problem we have that we need a solution to here for patients, and quickly, is how does a patient outperform using personalized, customized treatment plans that is an exact formula for their type of cancer? How to help them with what brought the cancer about, epigenetic shifts that bring about those cancers, infections, chemical toxins, other genetic variants that occur that make that cancer come forth. How is that treated? That needs to be part of the plan, and that's also completely ignored. And then a proactive plan needs to be put in place to help the patient win and outperform conventional and integrative treatments with a result-oriented approach. Now, another problem that we typically see is that the idea that the ignoring of what we call the terrain or the host. The patient's body is very important. Look at these two bowls here on this image. You have a dirty bowl and you have a clean bowl. When you look at what's feeding the cancer, chemical toxins, infections, chronic inflammation, oxidation, oxygenation problems, acidity, glycemic issues, immunity, as you can see, many of these need to be customized and built into the treatment plan to help the long-term remission, the long-term stopping the growth of the cancer, and that is almost virtually ignored in the conventional and not completely done properly by most integrative centers. The fourth issue we have is, where are people going to get this integrative care? All the types of treatments I was talking about and overcoming those problems, you can't do it with the conventional. Though many advertise integrative medicine, they really don't do it. Having an organic cafeteria and offering supplements is not integrative care. So here we're looking at the different options people are, but they're very limited. Chiropractors limited, with nutritionists, though helpful, limited. Acupuncturists, helpful but limited of what they can do by their scope. Naturopathic doctors, even in states where they have great licenses and they can do IV therapy like ozone and vitamin C, they're still very limited to high-level integrative care. And then you have a group of doctors like DO and MDs that have special licenses like in Arizona, Nevada with an MDH licensure to do more, but they're still very limited in their ability to help you with the technology that patients need. So I want to introduce you to the future of cancer treatment. And it's really about putting together a comprehensive plan of both conventional and advanced natural medicine, using the best targeted genetic information, specific information of what brought this cancer forward, and then targeting it to help the patient. But not just stopping there, but using proprietary technology to help save lives. One of the big reasons that cancer patients die or fail therapy is because they cannot stop the spread or the metastases. We at Invita have proprietary technology. For over the last 12 years, we've developed some of the best and most innovative technologies in integrative medicine found anywhere in the world, and we help to target that for each patient. Here's our center in Scottsdale, Arizona, where we treat patients from the U.S., Canada, and from all over the world. Here's our center in Hermosillo, Mexico, on the second floor of SEMA Towers with Dr. Joel Bedell, who's our hematology, oncology, bone marrow transplant specialist, who works on our cancer cell vaccine with our patients. And our team of MDs and DOs. You will find no team like this in integrative medicine anywhere. And I love this quote: "The achievements of an organization are the results of the combined efforts of its individuals." Our MDs, our DOs, led by an integrative approach, not just using it, but led by a detailed, personalized integrative approach, makes Invita one of the most special and comprehensive cancer centers really anywhere in the world. We can help you outperform. Let us help you. The best place to start, we always say, is education is the best prescription. Learn about your options. Send us an email. Give us a call. We have patient care educators standing by that are able to help you, answer your questions. And we're here to do that. We've been doing it for over 12 years, and we've helped thousands of patients. We want to wish you the best health and the best outcomes.